It's actually that the number of issues folks are having at the same time is on average five. So it's not an isolated, I'm just leaking. It's maybe I'm leaking and I have painful sex, or I also have low back pain. And so all of these issues combined are creating what we perceive as really a public health issue. It's an epidemic. And I had the most amazing labor and delivery experience. Like, I was in this beautiful room. We had a view of downtown and, the Hollywood Hills. And like, this is just, whatever. It's Cedars-Sinai and we got a great space. And then you give birth and all of a sudden you move to the closet, right? You're like, okay, my husband no longer has a place to sit, barely. I'm not getting the care. I'm figuring out how to just be a new mother. And there was zero conversation at Cedars-Sinai, one of the best health institutions in the country, about my physical recovery. And I knew to ask and I knew what to kind of seek for myself. But if you don't have that information and you don't have that network built in for support, I mean, you've seen this better than most.
Hello and welcome. I have the honor and pleasure of speaking with Carine Carmy, the CEO and co-founder of Origin. And Carine, I want to get right into this 2024 Pelvic Health Study. Just a little background on why this speaks to me so importantly. As you know, a lot of our work is really bringing rehab therapy services in the hospital after birth, after major pelvic surgery like a hysterectomy, like an endometriosis surgery, all of those major surgeries that impact function. The same way someone after a knee replacement, after a hip replacement, after a shoulder surgery. Carine, I have walked around with patients in the hospital after a shoulder surgery, and yet I could not get a physical therapy evaluation order to treat someone after a C-section. And when I read the first statistic in this Origin Pelvic Health Study, 83% of women my age, 18 to 59, experience one pelvic health symptom in the past year. 79% of women who had a baby in the past 5 years say their symptoms, pelvic health symptoms, negatively impacted their lives. What was the driver behind this study? What made you do it?
Yeah. Well, first of all, thank you so much for having me. It is an honor and a privilege to be speaking with you. This work you're doing is so incredibly important. And I think, the driving force is exactly what you said. Women are not getting the care that they need. And the prevalence of these issues is actually far greater than anyone has ever appreciated. And so I think our historic understanding was that, one in three women maybe had pelvic floor dysfunction. It was somewhere in that one in three or one in four range, depending on who you asked. And as we start to talk to patients, I mean, from your practice, and we see this with our patients all the time, not only is it much higher in terms of that prevalence of symptoms and experience, it's actually that the number of issues folks are having at the same time is on average five. So it's not an isolated, I'm just leaking. It's maybe I'm leaking and I have painful sex, or I also have low back pain. And so all of these issues combined are creating what we perceive as really a public health issue. It's an epidemic that has been lurking in the shadows, that we were whispering about because no one wants to talk about sex or private parts. But truly, these are, fundamental healthcare issues. And we know, and that when they go unaddressed, it can lead to far worse outcomes for folks through every stage of life.
That title caught my attention. An epidemic, a pelvic health epidemic that's on the majority that's affecting millennial women. Why our age group? Why so much?
Yeah, there's a lot of questions that I was thinking about, and we didn't get to go into the data, specifically as the why, but what we did see was that historically folks would think about pelvic health dysfunction as something that impacted women as they age. You're going through perimenopause or menopause and your muscles are weakening, and maybe any injuries you had from birth, or, just from aging are now getting exacerbated. We also know that as we age, issues like incontinence can become far greater. I don't know that the data is showing that it is worse today for millennial women than it ever was for this population or age. It's this that we're talking about it. And you've seen this on social media. You've seen this, in the press. People are starting to have real talk. And I think this is now just becoming something we're able to get out of the shadows, where folks are saying, not only is this a real healthcare issue, I'm not getting enough support from the medical community. And I think that was one of the most, not necessarily surprising, but just kind of that deep breath, depressing moments when you see that 1 in 4 women postpartum are not feeling like they're getting any support for their physical recovery. It's probably even more than that if you actually think about what does support mean and what should we set the bar to. But I think it's that millennials in general are setting a higher expectation of the medical community, and in the absence of that, they're sometimes actually turning to other solutions that may or may not be effective or may or may not have positive health outcomes.
You're absolutely right, and that was their physical recovery. So there was some
Exactly.
expectation of how they would function sometime after birth, and they weren't getting that expectation met. And that was surprising to you as well?
Yeah, I mean, I think that is that brute force awakening. I recently had a baby myself, and she's now almost 17 months. And I had the most amazing labor and delivery experience. Like, I was in this beautiful room. We had a view of downtown and, the Hollywood Hills. And like, this is just, whatever. It's Cedar Sinai, and we got a great space. And then you give birth, and all of a sudden, you move to the closet, right? You're like, okay, my husband no longer has a place to sit, barely. I'm not getting the care. I'm figuring out how to just be a new mother. And there was zero conversation at Cedar Sinai, one of the best health institutions in the country, about my physical recovery. And I knew to ask and I knew what to kind of seek for myself. But um, if you don't have that information and you don't have that network built in for support, I mean, you've seen this better than most. I had a vaginal birth. It was pretty uneventful. Imagine if you have a C-section or if you have, complications. Not only is there the long-term rehab that all of us need, but you actually have a shorter-term rehab situation that's far more acute that is overlooked, and it's wild. We're living in the Stone Ages over here.
You're so right, and when you say a shorter term rehab, I wanna make sure that even the audience viewing this later understands what you mean. What do you mean? Because I'm thinking more of after
Yeah,
a vaginal delivery, they're home within the first 24 hours. After a C-section, a little bit
exactly,
longer. Potentially, if there were some complications, they may be in the hospital a little bit longer, but most, women have told me no one went over what I should be doing before I went home. No one asked me, "How much help
exactly,
did I have?" No one asked me if I had stairs to go up and down. And so, when I think about the length of hospital stay, it really doesn't matter, even if you do have the privilege of being in the hospital a little bit longer, if no one's actually asking you things that can connect you back to what you're going to be doing at home, right?
exactly. That's exactly what I mean. And I think the longer term rehab plan is more, how do I get back to exercise and function and kind of that 6 week plus moment that is also a massive gap, and I think can be really deeply related to mental health outcomes too, if you want to think about how can I get to function and these things that make me feel good and like myself. But then to your point, there's that immediate window where you're like, okay, wait, I have scar pain and I'm healing, and what does this actually mean, and how am I supposed to carry my child but also deal with this pressure that I'm feeling, and when is it okay to start moving properly? I had a lot of questions even for myself, and that's why I started using virtual care within the first few days after giving birth. Like, I wanted to move. I didn't want to move like a crazy amount, but I was just like, okay, I'm feeling antsy in my seat. I want to just actually do some diaphragmatic breath. Is that safe? How do I know what the boundaries are, so that I'm not creating harm, but I can also trust my body?
Karine, this is probably one of the most exciting um, new avenues for me is virtual physical therapy, virtual pelvic health care being offered within days of birth. Why this is, probably so, to me, I think that is obvious to those practicing in the field, is that that therapist has the ability to spot concerns so much earlier than the provider waiting 6 weeks to see that
Hmm.
person. And those concerns that we've done in a lot of the studies that we've, partnered on, have seen that most complications that are affecting the maternal population are happening within the first 6 weeks. Over half of the deaths that are occurring in this country are occurring
Yeah.
before 6 weeks. And so virtual care you actually had that for yourself. Can you share a little bit
Mhm.
about what made you go that route rather than going into the clinic after you had given birth?
Yeah. Well, I think one, we typically are not seeing patients in person prior to that 6-week mark because you want to get cleared. And we will do sometimes that work, but typically there's not even necessarily an option to come in person in those early days. And you're figuring out like, how do I wake up in the morning? Getting anywhere in that first 6 weeks is always a challenge. And so I think there's a both safety and convenience that can happen in the comfort of your home, the intimacy to know that it's okay if you have your child on you for a period of time, and that you can talk about these issues in a really safe and private space is really critical. So there's just the modality, the kind of structure of virtual really lends itself well for that immediate postpartum period. And I think what's so powerful is that there's this opportunity for screening for kind of red alarm issues that you're not going to get because you don't have that OB call and there's no one coming to knock on your door and check in because we're way behind other countries. But in addition to that, at least for me, my driving factor was actually more mental health. I had a lot of anxiety postpartum around how to recover, around do I have prolapse or not? I probably knew too much. And so I also, clinically had postpartum anxiety. And so actually just being able to talk to a clinician who I knew was an expert in what was going on, even if they couldn't give me a full answer, just this idea that there was a partner who was looking out for me felt so relieving. Whereas I think if you don't have that, you're in this vacuum. And I think other providers can offer parts of this care. So postpartum doulas can be really supportive, don't obviously have the same medical training. And so there's that gap. I think lactation consultants often fill in this gap too and can often, support on some of that, red alarm issues. But PTs are so uniquely suited to support the mother with their own physical recovery. And I'll note, I'm not a PT. I was an early patient, years prior, but I'm just obsessed with and so inspired by this therapy and, these practitioners, you and everyone on our team, the deepest level of expertise in the female body, in function, and this balance between what I think we view as traditional healthcare, like the red alarm issues, but also, functional and wellness healthcare, which is so critical to our mental health and to how we live in the world.
I love that you said, this about mental health. May we celebrate it as Maternal Mental Health
Yeah,
Awareness Month. And a lot of the work that I'm really excited about what Origin is doing is this really highlighting that. I am a consumer, an avid consumer of your blog. There's so many just real issues that Origin covers. It's an incredible read. I have to just recommend that if you're looking for blog content that's really getting deep into issues that are more just than the pelvic healthcare issues that we think about, but really mental health, just family dynamics, all of those things. Your blog content, I have to say, has really changed the way I've been approaching the early work that we're doing. Is that it's not this biomechanical, how would I evaluate how you're moving, robotic type of treatment and care that we traditionally see, with a lot of post orthopedic rehab, and I do make references to that. But a lot of what we're doing with individuals after birth, so early on after their experience, whether it was traumatic or whether it was a beautiful experience, is really taking into account the mental health piece. And I want
yeah.
to get a little bit into the work that Origin is doing because you're offering virtual care in all 50 states.
Hmm.
That's amazing. That's so accessible for
Thank you.
people who are not ready to leave their home and leave kind of that comfort in that nest, where they're bonding with their newborn. How did that come about? How did that come about that that was going to be one of the driving services that you were going to make sure Origin was offering?
Yeah. Well, first of all, thank you for the kind words on the blog. And I take no credit. We have an amazing team led by Nikki Zeman, and she's really bringing, and I think this is the virtual perspective too. How do we bring much more real talk, and destigmatize the shame that exists around these issues and look at it from that holistic lens? Because we're not body parts, we're people. And our minds are our brain and our bodies functioning together. And so we have to look at it that way. And we know that will improve outcomes. Um, virtual was so interesting because we had always had a vision for virtual care and more digital interventions when we started the company. But in the early days, as you know, there was no reimbursement for virtual physical therapy from insurance companies. And there was really no model of care back in 2018, 2019. But then the pandemic happened, and the silver lining for us, at least, was we had to get virtual care up and running very, very quickly. California had pretty extreme lockdown measures in those early days. And so we were closing our four walls and wanted to make sure we could preserve care for our patients and, preserve the work for our team. And so we got virtual care up and running, and Liz Miracle, who leads our quality education, helped build some protocols and training to say, okay, this is what we're doing and this is how we're going to do it, and let's figure it out all together. And I remember some of the PTs who were very kind of, I'd say, not into it or didn't believe in that modality in the early days are now some of the biggest advocates we have for virtual care. And I think for pelvic floor and especially perinatal postpartum care, virtual is such a great modality because one of the number one interventions you have as a PT is education. You're helping folks understand their body, therapeutic exercise as well, in those early days is really critical. And so you don't need to be in person every week. And it could be both virtual only or in a hybrid model where you come in the clinic, make sure you have a clear diagnosis if that's a question, and then go back to virtual care. And so in 2020, we launched a pilot just to keep our doors open and really started refining the model. And we expanded to California, New York, and Texas in those early days. And then in 2023, we launched virtual care nationwide. And this was more of an operational challenge than anything else. I was out on mat leave, so I take, again, no credit for what the team had to do here. It was really complex, both from a licensure standpoint and working with all the PT boards in various states, working with different insurance companies and building out this regulatory framework so that our clinical team would be protected and there's compliance in place. And I think to this day, we're still the only nationwide network for virtual physical therapy for women. There are others who are offering, I'd say pelvic floor coaching. And I think that's also a great way to provide support for patients. And it's part of the care continuum, but really doesn't replace the need for one-on-one clinical care.
No, no, and I think honestly, like we started out this conversation, protecting that gap period. It to me, it is
Yeah.
the leading solution in protecting that gap period and making sure individuals are not falling off. We know the follow-up rates of OBGYN visits at 6 weeks. We know the
Hmm.
drop-off rates. Your study revealed that 92% of women are not being seen by a pelvic physical therapist after birth. I mean, that's
Yeah.
the Origin 2024 study, to me, has given me so much now to kind of build on in terms of why we're pushing that individuals have greater access to pelvic health therapy through either virtual
Yeah.
care services, through hospital-based services, home-based services, whatever those early services are, that's really protecting the gap period and making sure we're not losing those individuals. I want to kind of bring this full circle, Carine. You got me so curious. You're not a pelvic health provider. You're not a physical therapist, but you were instrumental in founding. You're the founder of Origin, a pelvic physical therapy company. Why that? Why this area of healthcare? Why healthcare in general? What's your story?
Yeah, I feel so lucky to be in this space and to work with, the most brilliant practitioners all over the country now. It feels like such a gift. Had you asked me, 15 years ago if this would have been my calling, I'd be like, what are you talking about? And what is your pelvic floor? So, I think in some ways it helps because I think so many of our patients are like me, like we're just learning out about our bodies. And I had a, more traditional career. I had been working in healthcare and technology for over 15 years before I started working on Origin, and I had seen from different aspects of the industry how to drive change, both within the system and outside the system. And I had different degrees of being jaded by healthcare too over the years, where I'm like, okay, there's so much possibility. Oh, the system is so slow and broken and expensive. And I took time off the last company I helped build, which was a digital health company, and did that thing a lot of people do in their early 30s and like blow up their life and try to put it back together. And in that time, I finally was dealing with some really deep healthcare issues. I have IBD, so ulcerative colitis, and was finally getting some more holistic care for that. And I had had a history of painful sex that I was never able to resolve when I was living in New York a decade prior. And so my now co-founder was a patient at a local clinic in LA called Bebe Physical Therapy. And Bebe PT was one of the only in-network practices in Southern California. And it was bustling. It was on the second story of a strip mall above a Chinese restaurant where the guys were smoking cigarettes all the time, and it was wafting in, and the carpets were dirty. And I was like, what's going on here? There's a 6-week wait list and we're in LA. Like, I don't understand, what is this? And we started getting care, and after 2 sessions, what I thought was a life diagnosis of, painful sex, I had a name for what was happening, I had a plan of care, and I realized, it wasn't the biopsy that I had had years prior. It's like, okay, let's learn how to connect our body, let's learn how to breathe properly, let's use dilators. And it was, although I didn't feel better on day 1, just such a sigh of relief to know that we could heal this. And so, just kismet, started talking to the practice owner. She was in the midst of transitioning out of clinical care, and they were figuring out what was going to happen. And Nona and I said, like, we can't, like, Bebe has to stay open. What are we going to do? Like, let's just start talking about this. And that was the beginning of Origin. And so we got to partner with that clinical team. And, for me, both my parents are small business owners, and I have a lot of deep value and respect for the hustle that it takes to run a small business, like keep a door open. And I think for us, our vision is not just about increasing access to patients, but how can we change what this industry looks like? Because look, we're not perfect and we still take insurance. And so we're still stuck by many of the challenges of that. But we will not see the level of change and access growth and PT growth in pelvic floor if we don't create a more sustainable model that has a little bit more of a balance for clinicians. And so really thinking about how we partner with local leaders and empower them with some of the back end technology and systems and other pieces of the business so that they can focus on what they do super well. So we're still ironing it out. We're in our early days, I joke, but I'm like, it's amazing. And I'm so honored that we've had such a big impact in such a short period of time in terms of our scale. And it makes me infuriated that this is, that this is where we're at right now, that like how we became so fast. I'm like, we gotta level up this whole industry and, make sure that there's more funding, more access, more payer coverage. Because 40 million plus people every year, women, people with vaginectomy, we haven't even talked about men, like these issues are so pervasive, and it's going to take many, many innovators in the space to shift the curve.
Carine, without like divulging kind of the back end conversations that you are having, what do you want to see, or where do you want to see Origin being in the next 5 years? Like what like really, I mean, you said the word infuriating, and all I can think of is what I heard was fuel for rockets. What I
Yeah.
heard was this fuel for change. That's what I love, is that this passion that's driven your company to be the leading pelvic health in the country in that short of amount of time. You've got my attention. Oh, where are we going?
Yeah. It's funny. I spend half my time really angry and the other half, inspired. And so you have to vacillate between these two. Otherwise it can, rocket fuel is a dangerous thing. But I think for us, it's all about access. So how do we increase access to care? And that includes both, one, getting better and more insurance coverage in more markets, opening more doors or partnering with local leaders who have amazing practices and bringing them into the fold, expanding virtual care. And what does it mean to get care virtually? We have our one-on-one model. What else can we do to support patients? Even our blog, like we have a couple 100,000 people on our website every month just getting information. And it's so critical because there's a lot of really good information on TikTok and there's some not great information on TikTok. So how do we get evidence-based information to people? And then I think for us on the policy side, we're in the early days of this, but there's some really big structural issues that I think we have to change. One is really thinking about the screening that is happening and how we can bring pelvic health screening to a similar place that mental health screening has gotten to, so that we're not waiting, years or decades to get care. How do we partner with folks like you and embed this care in the health system, where patients are expecting, that this is part of their plan of care? And also, how do we expand what types of patients get this care? I mean, we're not able to take Medicaid today because of the reimbursement structure. And so we have to think about how do we open up access beyond commercial payers and Medicare. And so for us, access is really our guiding light. And kind of there's a lot of different ways we can do that, obviously in partnership, because it's going to take a lot of support to get there.
This has been this study, the 2024 Origin Pelvic Health Study, was just eye-opening. I'm hoping to see so many more studies like that. I'm right there with you. I think that Medicaid being the biggest payer
Yeah,
is like that population. I'm seeing it time and time again. And the fact that you're willing to part, it's important, Karine, because we know in the hospital, they're not going to turn people away. If there is any indication that that person
hmm,
go home and actually be worse off or be readmitted back to the hospital with a complication, to have some type of services that are available for that for those populations that are being treated, that are being covered through Medicaid services while they're in those institutions, makes so much sense. And it makes sense to offer and expand virtual pelvic health services within the first week, if we can, after
yeah,
someone is home after a major pelvic surgery or a birth experience that they weren't expecting, right? Or even a screen for their mental health and their pelvic health. Like that to me is
yeah.
so exciting what Origin is doing. How can people support? What can we do? The people on, in the audience, the people who want to just jump in and say, oh my gosh, they're doing so much. How can I be involved in it? What would you say to people?
Yeah. Well, first of all, thank you, because we're going to need to partner to get this done. I think one, if there's anyone in the audience, within the health system that wants to think about partnership, we are already doing that in lots of different markets now, and really thinking about what that model is. And so, would love to have that conversation. Any researchers would love to have a conversation with you. We're not set up yet fully for full research partnership, but that's a really big goal of ours. We're sitting on so much data that could help inform how we both think about treatment models historically, but also innovate. And I think prove out and make this so obvious. Like we have to make these issues so painfully obvious that it feels like a public disservice that we're not there yet. And I think we're really close. And that was part of the study and our goals there. And if you're a practice owner or want to join our network, would love to hear from you. I think we're being really thoughtful about how we grow, and especially in today's market, but we really want to partner with incredible leaders in any way we can. And so if you have an idea that I haven't named, like obviously please reach out. And I think, Rebecca, I just want to add one thing to what you said around the postpartum experience. My dream is that we're actually starting when you're pregnant, because if the first time you heard about mental health and postpartum depression was after you gave birth, you would not be even in the right mind to think about that. We have to start these conversations when you're pregnant. And I think one of the protocols we're, investing in is really around labor and delivery prep. I didn't fully understand what it meant to push before I was in, you know, in care. And so pushing is lengthening, and just having a couple of those conversations with a physical therapist before you enter into a labor and delivery moment that is high stress or high stakes can be so helpful, both physically and mentally, and can prime you to know, yeah, these are the 5 issues that if anything, feels funny or painful or challenging, this is why you would go to PT later. Even if it were just one appointment, I think we would see better outcomes. And so I'm really bullish about that. And we see a lot of our patients who work with us postpartum. They often start postpartum, and then if they have another kid, they come to us pregnant because they realize, oh, I could have actually been, or I would love to be preparing for labor and delivery in a different way.
Carine Carmy, CEO, co-founder of Origin Pelvic Physical Therapy for all bodies, leading the way really in not just pregnancy, postpartum care, all pelvic health conditions. I completely agree. This is probably one of the companies on the kind of the roster that I'm holding very high, that I'm following very closely. I believe they're a leader in this space. I believe that the work that Origin is doing is actually making it so accessible and so easy for people to get answers before they're in that situation. If you're pregnant, if you're prepping for a major surgery, you have resources through Origin. You have pelvic therapist that you can be asking questions about to prepare your body and to really, really jumpstart your early recovery and function. This has been wonderful. Carine, thank you so much for your time today
Thank you
and
so
for the
much for having me. It's an honor.
2024 Pelvic Health Study that Origin has published and partnered with Ipsos on. Thank you for that.
Thank you so much, Rebecca. It's really an honor, and I look forward to many more conversations with you and others in our field. Thank you.
Completely agree. See you soon.